Hello, my name is Kristen Gulbransen. I'm a PhD candidate at the University of Manitoba in the College of Nursing. I'd like to begin by acknowledging the traditional territory on which we are gathered today. I would like to thank the Indigenous peoples whose footsteps have marked this territory for centuries. These include where I live and work, the Cree, Saulteaux, Blackfoot, Nakota Sioux, and Métis. The title of my poster presentation for the Helen Symposium is A Scoping Review, Best Practice Guidelines in the Birth Setting for Pregnant Persons Who Use Methamphetamines. As a clinical nurse, researcher, and nurse educator for the past 20 years, a trend that we continue to talk about is the growing concern of methamphetamine use in pregnancy. It is often accompanied by grave consequences for the person and developing fetus. The use of MA in our areas, including Winnipeg, as noted by Nickel, a researcher at University of Manitoba, and his colleagues, is that MA, methamphetamine, is one of the most common illicit drugs taken by women who are pregnant. The study objective for this scoping review was to use the scoping review to explore the existing literature on best practice guidelines for safe, dignified, and compassionate care in the labor and birth setting. The data sources that we used were searching for articles and best practice guidelines from health-related databases, many which you may be familiar with, Medline, CINAHL, and the Web of Science, including the Core Collection and Social Science Citation Index, PsycInfo, Women's Studies International, and Sociological Abstracts. We are fortunate when we looked at the study selection that were English language, peer-reviewed reports of primary research, systematic reviews, and practice guidelines from these credible databases and organizations to be able to find and screen 1,297 resources, and finally agreed with 2 reviewers and a 3rd reviewer for discrepancies to review 156 articles and 16 gray literature resources in the full text. The final, as following the PRISMA diagram, you can see is that we had 9 resources in the end for inclusion criteria. We summarized these best practice guidelines. These included universal screening for pregnant persons, assessment and management of analgesia during labor, as well as a broad guidance regarding the inclusion of a multidisciplinary healthcare team. Safe, dignified, and compassionate care approaches were focused on communication, shared decision-making, and the provision of non-judgmental care. Although evidence about substance use during the childbearing years is growing, stronger evidence for clinical care approaches in the labor and birth setting is needed, inclusive of all stakeholders' perspectives. The articles and best practice guidelines reviewed provided these broad clinical recommendations that were applicable specifically to pregnant persons who use methamphetamine. However, we did not find a complete comprehensive best practice guideline for labor and birth that was specific, very solution focused, and delineated a safe, dignified, and compassionate care approach. We look forward to doing more research in this area and sharing more as we work through my PhD research. My supervisor is Dr. Kellie Thiessen, and I am supported by a great committee, including Dr. Wanda Phillips-Beck, Dr. Heather Watson, an obstetrician at Clinical Health Sciences, Dr. Patricia Gregory, and Dr. Javier Mignon. Thank you so much for attending. If you have any questions, please feel to reach out, or you can find me on Twitter at KA Gulbransen.